All right, welcome back, friends, to another class of ethics in medicine. Today we are looking again at the right to refuse treatment. This with Dax Cowart, which is a little different than the Mary Northern case we looked at. Uh, but again, it goes into last week's assignments on, what is a quality life? Can we even measure one quality of a person's life against another's? We looked at the quality adjusted life years. Um, And here we have a really interesting case. So I'll just read briefly from 312. So a freak accident left Dax Cowart, or Don Cowart, before he changed his name, with severe burns on over 65% of his body. From the very beginning, Don expressed the desire to die. So he was in a car accident with his dad. His dad died instantly. He was burned all over his body, extreme burns from moment one, wanting to die. He's like, just let me die. At first, his doctor dismissed his plea to stop treatment as the typical response of burn victims to the pain of their wounds and treatment. However, long after psychiatrists found Don to be competent to refuse medical treatment, the treatment continued against his will. It is unlikely that this would happen today, which led us to the question of whether we should keep the case in the current edition. Ultimately, we decide that this is not merely a classic case, it remains relevant not because anyone today would defend doctors for forcibly subjecting a competent patient to terribly painful treatment long after he'd been judged competent to refuse. At the end of the day, the right of competent patients to refuse even life prolonging treatment must be accepted. However, as the dialogue between Dax, as he came to be known, and Robert Burt makes clear, the difficult question is when is the end of the day? When should the decision to refuse life saving treatment be accepted? If not immediately, because a patient undergoing tremendous suffering may have his judgment clouded, how long may doctors delay accepting his refusal? A related issue is a doctor who knows from experience that patients just like Dax ultimately have worthwhile lives justified in continuing to try to change his patient's mind? Is a prolonged attempt to get the patient to see his life can be worthwhile in the end compassionate medicine or unacceptable bullying? So the guts of the story were, here's a guy who literally like was in rodeos. He was captain of the football team. He was a Air Force pilot. I mean, this guy was a physical guy. And when he got injured, like he was broken, he was blind, he lost use of his hands, and he was like, I've got nothing left. And he wanted to die. Should they respect his autonomy? Was he acting autonomously, or what were the cognitive, psychological, emotional constraints, social constraints, physical constraints affecting him, right? As we've talked about in previous classes. And just like we used the case of the woman who got depressed when she was going through her cancer treatment, and she kind of was just like, I want to leave me alone. And they were like, this is unusual. Like, this is clearly a psychological constraint. And they stalled and they stalled. And eventually she came around and continued treatment. And we're like, all is well that ends well, right? Well, like, at what point do we respect a person's opinions and values are what they are and they're not clouded, right? Because as a person who's been very able bodied, I would struggle to wake up, handicapped in any significant way. Most of my, a lot of my value from life comes from my physical activities and just the way I move in the world. And if I was really, like, say, a quadriplegic, which both my parents were nurses and took care of exclusively when I was young, I spent a lot of time around quadriplegics. I don't know if I would want to stay alive, right? Could I find value as a quadriplegic? And if I said no immediately, would you be a good healthcare worker if you respected that, or should you stall for time? Right? You can see how this plays. So, from the mouth of the man himself, here we go. Come on, baby, load. Maybe you can't load. Can you load? Maybe you're frozen. Let's find out. In fact, I'm going to have you actually go watch the link and then come back to this so I don't get like some sort of YouTube infringement or something. Yes, shall we just keep Mr. Doak in business for the time being? But as you can see, he suffered excruciating treatment. His, he tried to commit suicide multiple times, and this is kind of one of those stories where it's like, well, here's a man who thought that he'd be selling pencils on the street corner, and what happened? No, he went on to find a meaningful life. He got his law degree. He defended, patients himself as a patient's rights advocate. And so it's kind of like, well, just like the woman who was depressed with cancer kind of bounced back and persevered, like, doesn't it justify keeping him alive against his will, doing these painful, debriding activities that he like found value afterward, right? And like, if you are a good doctor, he's the one in the best perspective to be like, well, how long should we like push and like push back against your desire to die until we decide that like no, this really is your thoughts, your values consistent with your own new or old long-term goals and values, right? And so it's kind of like, well, correct me if I misstep here, Dax, this is on 349. But just on the face of the matter, it seems to me that until your accident, you were a member of the able bodied community, and a very able bodied member at that, for whom your physical prowess was a matter of great importance and pride to you, suddenly and deeply beyond your control, in a way that can happen frighteningly to any of us. You found yourself pushed over this divide between the able bodied and the not able bodied. But you inevitably brought with you attitudes that were shaped at a time when you were comfortably, happily, proudly a member of the able bodied community. And so here you can kind of see this pushback against, when you became disabled, you thought that that life had no value because you had lived your life with all of this promise. But really, to judge the value of a life is a very unique and difficult thing. And if you were to ask many people who were with these disabilities or conditions or ailments, what whether their life had value, indefinitely you would find that they would say, yes, absolutely, I value this. I find meaning here and here and here because it's so individualized and specific. And whenever outside circumstances thrust change on us, it takes us a while to adjust to it, to get our goals and values and beliefs adjusted to it, right? And so he's saying that's like, clearly it took you some time to adjust to it until your constraints moved away and you had sort of a new sense of autonomy, right? Like, when is that, right? Uh, how realistic was your perception at that point, just a few months after your accident, that all you were going to be was a blind and a cripple? How realistic was it of the full range of capacities that could be held out to you, even if you were permanently blind and even if you were permanently unable to walk, which it turns out, of course, you were not? How much contact had you had with people with significant disabilities of these sorts? How much were you devaluing your own capacity, thinking, in fact, you would be able to do nothing more than your mother's observation in the subsequent interview? Sit on a street corner and sell pencils. But this is a very common fear of able bodied people who have had no substantial contact with people with disabilities. In response to this, Dax does not mix words. The right to control your own body is a right you're born with, not something that you have to ask anyone else for, not the government, not your treating physician, not your next of kin. No one has the right to amputate your arms or your legs without your consent. No one has the right to remove your internal organs without your consent. No one has the right to force other kinds of medical treatment upon you without your consent. There is no legitimate law. There is no legitimate authority. There is no legitimate power anywhere on the face of this earth that can take the right away from a mentally competent human being and give it to a state, to a federal government, or to any other person. Justice Brandeis says the makers of our Constitution sought to protect Americans, their beliefs, their thoughts, their emotions, and their sensations. They conferred against the government, the right to be left alone, the most comprehensive of rights, and the right most valued by civilized man. Nothing suggests that Justice Brandeis thought an individual possessed these rights only as to sensible beliefs, valid thoughts, reasonable emotions, or well founded sensations. I suggest that he intended to include a great many foolish, unreasonable, and even absurd ideas that do not conform, such as refusing medical treatment even at great risk. So here you see the man who wanted to die, tried to die any number of times, some pretty brutal attempts, found a meaning to life, found purpose, bounced back, and still fights for the rights of others to die if they want and to refuse treatment. And so now we're going to pivot next to kind of some end of life situation planning, advanced directives, various circumstances, living wills, and stuff like that. So I will see you on the other side.